Hello class, welcome to Speech Disorders in Children for Cycle 3, Manhattan Campus. This is Professor Hoffman. I hope you're all doing well. I wanted to take this time to go through some information, basic information that will help you through the course, and then we will start with our first topic. So today I'm going to be recording this audio along with a video. The video, however, is not going to be something you need to watch. You're just going to listen to the audio as you go through first the syllabus with me, and then basically today I'm going to take you through the textbook. My lecture is going to be based on the first 3 chapters in your textbook. What I've done this semester is I'm going to be doing these audio recordings or video recordings possibly throughout the semester on your off days when you're not at Manhattan Campus, and that's where we're going to go through the information in the text. And then when we're at Manhattan Campus, for those few sessions, we are going to do more hands-on work that requires you to understand assessment and actual treatment. And that's how we're going to break up the semester. So first off, get your syllabus out. Take out your syllabus, and as we go through that, you can look on as you listen to me as I go through the syllabus. We are in speech disorders in children. This is an intensive study of articulation and phonological development and disorders in children. So we will look at the development of typical articulation skills and phonological skills, as well as disorders in these 2 areas that affect children and their sound productions. Emphasis will be on clinical assessment and intervention, and that's, as I spoke before, we will focus on that as much as possible in class so you have a hands-on kind of approach to that. Special topics will include, and this is based on the syllabus that is typically created for this class, phonological awareness skills and literacy acquisition, childhood apraxia of speech and foreign accents, regional dialects. I do feel like we touched on phonological awareness skills in the previous course that you took with me, and you also touched on that in your first course with Dr. Reem Khamis Dequar this year. So we're not going to focus on that throughout this course, but we will look at childhood apraxia of speech and hopefully get to foreign accents and regional dialects in children. The course objectives are pretty clear. You will hopefully gain a better understanding of the nature of phonological and articulation disorders in children, as required by ASHA. Understand the assessment process of the 2 areas. Understand various intervention strategies for children with disorders in this area. Finally, gain some understanding on ethical and cultural decision-making that needs to happen. See how the role of families plays on team members. Professional behaviors in the academic setting, that's what you will be doing and showing me. And finally, evidence-based practice will always guide our thought process and how we are going to work with children. And I will gain a better understanding of your professional writing skills, and you all will learn how to write professionally as you go through the class, I hope. Performance outcomes with the School of Education Conceptual Framework you can take a look at on your own. University Statement on Accommodations as well, Academic Honesty and Disorders, Communication Sciences and Disorders Code of Conduct. Please take a look at that. Okay, if you jump down to the 3rd page of the syllabus with me, you'll find the required purchases. The textbook that we will be using for this class is Articulation and Phonological Disorders, Speech Sound Disorders in Children, written by Bernthal, Bankson, and Flipson. I chose this book because it is, first of all, it's fairly recent, the 7th edition. It is also a text that many universities use throughout the country, and I feel that it is a text that we use clinically. There is information in the text that you can always go back to as a clinician, and I feel that that's extremely important. So please make sure you get a hold of the textbook. I will be providing you with material as we go throughout the next couple of weeks on Moodle that you should take a look at. And finally, other readings. Now this is something you do not need to purchase the Goldman-Fristow. You do not need to purchase the Kahn-Lewis. Nor do you need to purchase just the manuals. You should have access to the manuals throughout the clinic at Adelphi. I will also be bringing these in for us to look at in class, but you do not need to purchase those. They are required, however. So finally, recommended, the APA manual is always something good for you to have if you do not have it as of yet. And there are some textbooks and books that are helpful that I'll mention now. The Manual of Articulation and Phonological Disorders. It was written by Ken Belial. I know there are a couple of editions out there currently. I'm not sure what the latest is. But it's very clinical as well. So you can always grab that if you feel like it is something that you want to have on your bookshelf. Yeah, I'll leave it at that. Okay. Assignments in grading plan, you could see that there are 6 assignments or things that are going to play into your grading. The speech sound project that we'll get into in a little bit is worth 25 points of your grade. The progress monitoring project is 10 points. Your final is worth 25 points. A therapy presentation that you will do is 15 points. An assessment project, 15 points. And finally, your attendance and class participation. Again, participation. What you contribute in class when we're there. Because we only have 4 sessions I believe, when we're together, attendance is mandatory, and you must participate and contribute to those classes. Everyone will start out with a participation score of 3, and then you have the option to move up or down based on your performance, similar to what we did last semester. Next portion of the syllabus, extended hours of instruction. Again, because we do not meet for the required amount of hours New York State has put forth, we do need to have some additional hours. The assignments and projects that are listed here will make up for those hours. Okay, I'm going to go through the weekly outline, and then we will get into some of the assignments and projects that we will be working on throughout the semester. This week, week 1, is a Moodle class, so that's why you're listening to me through Moodle. I will go through an introduction of speech-sound disorders. I will discuss normal aspects of articulation and speech-sound acquisition. This lecture that I will perform today is related to text chapters 1 through 3, and some additional information that I will be giving you. Next week, we are on campus, week 2, February 3rd. We will focus on speech-sound assessment. I really want to get right into the assessment process. That reflects text chapter 6. I will go through some of the projects that are required of you as we go along, but what I would like to say, as of today, start brushing up your skills in phonetics and writing an IPA and transcribing. Okay, I will be giving you guys some weekly quizzes. I don't even want to call them quizzes, just I'm going to give you some items that you're going to have to transcribe just so you get used to that technique and practicing your skills. So if you're not comfortable with transcribing, spend the week looking at some things and practice transcribing. I'll use that, practice quizzes. I just want to give you a chance to practice your transcribing skills. So don't be afraid that the quiz is going to negatively impact your performance in the class. February 10th is week 3, another Moodle class. You do not have to show up to Manhattan campus. We will focus on some theories and background information regarding speech-sound disorders. It will refer to chapters 4 and 5 in the text. The next week, we will be at Manhattan campus, February 17th. You will be handing in your speech-sound project that day. We will focus on intervention. So next week, we will focus on assessment, and then on the 17th, we will go right into intervention. And that will help us, text chapters 7 through 10 will help us with that. So please, as I always say, you should be familiar with the text prior to coming to class, and then our classes will highlight what is most important in what you read in the text, and then I would go back into the text and highlight and focus on those areas that we talk about in class. The week after that, week 5, February 24th, is another Moodle class. You do not have to show up to Manhattan campus. We will focus on language and dialects and how that affects speech sound disorders in children, or the articulation and phonological productions of children. Text chapter 11, okay? The week after that, March 3rd, week 6, we will be meeting at Manhattan campus, and we will focus on some special topics like apraxia, oromotor, and some special techniques that I think you might find interesting and that you might come across as you head into the field in your clinic. And things such as prompt therapy and the like. So we will get more into that as we get closer. The week after that, I have a Moodle class. I'm kind of holding off on what topic I want to say just to see how well things go throughout the semester and what topics we need to expand upon, what we might need to review, what we might have more time to do. And finally, week 8, March 17th, we will meet at Manhattan campus, and you guys will take your final exam. It's an in-class exam, and show your presentation, okay? So that gets us through the next couple of weeks. On the next page, page 5 of the syllabus, you can find a summary of the assignments and when they're due. The progress monitoring probe is due on February 10th. I'll get into that, and you could read through the next things that are on the summary of assignments. Everything is due on a day when we have class except the progress monitoring probe. So progress monitoring probe, you will email me the assignment by 5 p.m. on February 10th. The other assignments you will bring into class. You must bring in a hard copy to class. Okay? Note some information on Moodle. And now we're going to get right in onto the various assignments. Okay. The speech sound project is worth 25 points in your overall grade. Students will be assigned a sound. For example, you may be assigned a t, or a s, or a b. I will send out those assignments on Moodle. Okay, you can take a look at the list as I upload that. You are going to write a paper according to the outline provided here. 1. You must explain how the sound is produced according to place, manner, and voicing, as well as distinctive features. So, is this a bilabial sound? Is it an affricate? Is it a stop sound? Is voicing involved? Notice I say you must explain these. Do not just tell me that the p sound is a plosive and it's bilabial and it's devoiced. Okay? No, I need you to explain what those mean and how that specific sound is produced according to place, manner, and voicing, as well as distinctive features. Okay? So is it a sibilant? Things such as that. Any resources that you can use to help you through that is fine. Next portion of the assignment that you will have to incorporate into your paper is an explanation of how the production of the sound in English may be influenced when it is a second language. So if English is a second language for this child, and they have a first language, okay, their L1, how their L1 is going to affect production of this sound in L2, which we are saying is English, okay? So I don't want to know how the sound is used in the child's native language. I want you to tell me how their native language is going to affect their production of the sound in English. Okay? You are free to choose whatever language you would like. You might choose something that you have had experience with. I know some of you speak another language, maybe Russian. Some of you have the Spanish background. So focus on how that first language is going to affect the production of the sound in English. Okay? If you have any questions, please feel free to ask me through email throughout the week, or we can talk about it more next week when I see you in class. Next, you are to describe the nature of 2 speech sound disorders associated with this sound. Okay? What sound disorders may be associated with production of this sound. Okay? And then 4, describe one technique to correct each sound disorder mentioned in number 3. So if your sound disorder is an articulation disorder, the technique should be one that is appropriate for a motor or phonetic disorder, because that's what an articulation disorder is, and we'll talk about that. If the disorder noted in number 3 is a phonological disorder, so say a person is demonstrating fronting, okay, the technique that you choose should be phonological in nature. And there's a list of some suggestions of techniques. This list is not exhaustive, okay? You can find other techniques that are appropriate. So take a look at that list and find anything else that's appropriate. But you must cite a reference for each technique that you use, okay? If you say that you are using minimal pair technique to work on an articulation disorder that affects the production of wa, then you must cite an appropriate reference for that technique. Okay? Another portion of the evaluation of the assignment, the paper that you will be writing, is an interview with a speech-language pathologist. Okay? You must interview a speech-language pathologist and focus on getting feedback on the techniques you've chosen. So, have you worked on this sound disorder? Have you worked on disorders producing the specific sound that you have? What techniques have you used? Have you used XY technique, and what have you found when using that technique with children? Is it appropriate? Do you see progress? Things such as that, okay? That must be incorporated into your paper. And finally, you must provide a reference list, okay? Your paper must be written in APA style. And you guys are familiar with my requirements for that, okay? If, for example, you do have personal communications, i.e. your interview with a speech-language pathologist, I provided you with how you should reference that. So you must cite it as last name, comma, first initial period, parentheses, personal communication, and then comma, the date when you had that communication. Okay? And then your in-source citation would be last name, comma, the year. Okay? If you have any questions, like I said, please feel free to email me. We can clarify things as I see you next week. Next assignment that I'm going to go through is the progress monitoring probe. I believe this is what is due first, February 10th, but you can check on the dates. Each student is required to develop a progress monitoring probe for a specific sound. Again, you will be assigned a sound. So if your sound is S, you will design a progress monitoring probe for S. Each student will be given his or her sound. Progress monitoring probes are meant to be administered periodically throughout the course of treatment in order to document progress and should be easily used to report specific data on a child's performance. So, as we learned last semester, RTI, response to intervention, says that you need to progress monitor. We need data to determine if a child still needs services or if a child has benefited from the services and progressed enough that they no longer need those services. What you will do is develop a probe, okay, that will demonstrate the child's proficiency. Probes are meant to be administered quickly, okay, in 3 minutes maximum, typically. You must hand in 2 copies, one electric on the day that it's due, and then you can hand in a hard copy when you come into class the next week. Okay, so I can provide you feedback. What this means is, if I see Johnny, and we're working on S, as I said, then I want to spend my therapy session working on that sound. I don't want to continuously be assessing, even though I'm assessing through my intervention. I may want to pass by his classroom and pull him out in the hallway and give him a progress monitoring probe. So I want to look at the sound in all positions. Okay, so I want to consider initial position, final position, medial position. I want to consider the sound in isolation. Is he able to produce it in isolation? In syllables, in words, and then finally in sentences and connected speech. I want to consider the sound in different vowel contexts. So if I'm producing the R sound, then a child may be able to produce it with a ah sound previously to it, as in R, or an an sound, okay? So vowel context is going to affect it. So think about having different vowels prior to and after the sound that you're creating the probe for, okay? Again, think about how you're going to get the child to say it. It's not a model. You might want to come up with some pictures. You might want to come up with some words that they should use in a sentence, okay? But you have a little freedom in how you organize it. Just think about what information you want to get from this short probe that you will administer. Okay. Next assignment is the group treatment project and presentation. You guys will sign up with a group, 5 in a group. One group, I think we'll have 6. I think we have 31 students. But you will sign up with a group. Each group will sign up for a treatment approach, okay? Please be prepared with groups during session 2, and your approaches will be assigned. So I want you to come in with your idea for who you want to be in your group next week, and we will be assigning the actual treatment approach that day. You are to prepare a 1-page handout for the class that includes a description of the approach, how speech targets are chosen, description of population it has been used with, annotation of an article, so you need a specific article, evaluation of the level of evidence of that article, and your evaluation of the usefulness of the approach. Okay, so you guys will present for 10 to 15 minutes on the approach, embedded in an activity for a child, okay? So I want to see an actual activity, okay? You must include an actual activity. So somebody may be the clinician and some other people in the group may be the students, okay? And you are to demonstrate the actual activity that you've come up with that will work on that approach. All members need to fully participate. If not, I don't want you guys to complain to me after the fact, but as we go through, if you notice that some members of the group are not participating, then I need to know as we go along so I can help you guys with those issues. Your presentations cannot be directly read from the handout. You have plenty of time to prepare these, and you must have all components necessary for the demonstration. So if you're using some kind of art throughout the project, throughout the therapy session, then you need to have those art materials for the therapy session. Okay, these are some of the approaches that you may consider. So if you get a chance to talk with your group, maybe come up with some, like a first choice or a second choice, and we could give out the specific techniques next week. Okay? And then, finally, the speech sound assessment. All students will be expected to administer the Goldman-Fristow to an individual. The assessment must be administered to anyone between the ages of 3 and 30. I would love for you to work with a child below the age of 6. So you are gaining experience, in transcribing the language or speech productions of a young child, since that's what this course is focused on. But if you do not have access to a child in the test at the same time, I will accept older participants. What that means is some of you may only have access to the Goldman-Fristow at the clinic, and therefore you might want to team up with another student and give it to each other. If you only have access to the Goldman-Fristow at the clinic and you have a relative or a student or somebody that you're working with at the clinic that you could bring to the clinic with you and you could administer, then that's preferable. You should start planning for this now. Get in touch with how you need to go about getting the Goldman-Fristow from the clinic and when you need to sign that out, for example. And start thinking about when you're going to do that, okay? At least administer it as soon as possible. Again, we're going over assessment next week, so on the 3rd, I believe. So you'll have an idea of how to administer the Goldman-Fristow after that. You must write up a complete evaluation, okay? And use the outline that I will provide you on Moodle, okay? You'll have an example of what an evaluation should look at and what areas that I want you guys to focus on, okay? And then finally, the final. Final will be in class. I will talk more about it as we go through the semester on what I'm going to look for. Okay? So that's the syllabus. I'll have some individual assignment information on Moodle for you guys to look at, so you can take a peek at the individual assignments a little bit more in depth. But again, if you have any questions, please feel free to send me an email. And if it's something that I need to go through more next week when I see you guys in person, we can do that. Okay, so I'm going to switch topics for a brief moment. I'm going to go through right now what I call my speech sound disorders vocabulary list. Okay, so these are some of the terminology, some words that you guys should be familiar with as we go through the course. Much of this information you will have already learned in previous classes, such as phonetics or introduction. Some of the information we will go through in more depth, but this is a vocabulary list of important terms that you guys should be familiar with as you're assessing children with sound disorders, as well as when you're intervening for children with speech disorders. I'm going to go through in alphabetical order, so please feel free to take notes, and then you can look up definitions further to expand your knowledge in the text and in other sources that you find appropriate. Okay, affrication. Affrication is an error pattern in which stops or fricatives are pronounced as affricates. So, for example, the word see, S-E-E, is pronounced as chi, okay? So we provide affrication to the stop or the fricative. Going on, alveolar. Alveolar sounds are consonants produced with constriction between the articulators at the alveolar ridge, okay, that's right behind your teeth, upper teeth, posterior to the upper front teeth, okay? Any kind of constriction in that area is an alveolar sound, such as ta, da, sa, z, n, o, okay. Apraxia. We will go through apraxia in depth, but know that it's an voluntary but not involuntary speech movement disorder, and we will talk about it as we go further. Articulation errors are typically speech errors resulting from problems in speech motor control, which we typically, in the past, have contrasted with phonological disorders. Now, the field is really going more towards the idea that all sound disorders or speech disorders are phonological in nature, since we break up linguistics into semantics, syntax, phonology, morphology, and pragmatic. Well, articulation disorders are going to fall under phonological disorders. So we're going to go in depth into the difference between an articulation disorder and a phonological disorder and a speech sound disorder, and where over time, over the past, I don't know how many years, the terminology has changed. Excuse me. Backing is another error pattern that we're going to get into detail with when we talk about phonological disorders. It's when a front consonant is produced in the back. We differentiate between back vowels and front vowels, so you really should know the difference between those. And you can go back to phonetics and look at your vowel quadrilaterals to have an idea. Because children with vowel disorders really may need to know how to differentiate between a back vowel, a front vowel, between a high vowel and a low vowel. So that's important to know. Bilabial sounds is another group of sounds. Central vowels, you should also be able to differentiate between front vowels and back vowels. A central vowel is when the tongue blade is the major articulator, and that's the only thing that is producing that sound, really. Our front vowel is up, as in love. Okay, let's see. Cluster reduction is another phonological pattern where a group of consonants or consonant clusters are deleted, or one of the consonants from that cluster is deleted. Continuants are sounds that can be sustained for an extended period of time. Okay, so those include fricatives, nasal sounds, liquids, glides, vowels, and diphthongs. Those are all considered continuants. Devoicing is when a sound that should be voiced is not voiced. Distortion is an inaccurately produced sound. Okay. Epenthesis is another phonological process or an error pattern in which a vowel is inserted between consonants where a vowel should not be inserted in the middle of a consonant cluster, for example. So the word greet will be pronounced gareet. That usually that mid vowel, is produced between a consonant cluster. Then we have final consonant deletion, in which final consonants are deleted. This is again another error pattern. Typically that final consonant is a plosive or a stop, but it does not have to be. Final consonant devoicing is something that is also apparent. It's another error pattern in which voiced sounds are devoiced at the end of a syllable. For example, the word bead, B-E-A-D, is produced as beat. That D sound is devoiced and produced as a T sound. Fricatives, a consonant produced with a small distance between the articulators, causes a hissing sound. So there's only a little opening between the two articulators that are producing that sound. And that's where we get that frication, okay? And we call those sounds fricatives. Okay, there are a few you guys should be familiar with those. Z, s, z, sh, zh. But again, it's probably hard for you to hear what I'm saying through the audio. Again, know the difference between front vowels and back vowels. Okay? Fronting is another error pattern that we contrast with backing, which we described. Fronting is when a back consonant is produced in the front of the mouth. Gliding is another error pattern where consonants produced with little constriction between the articulators. So glides are ya and wa. There's really only a little amount of constriction between the articulators. They're more vowel-like in nature, in a sense. Whereas the gliding process is a process in which liquid consonants are produced as glides. So, ol is produced as w, okay? Or is produced as wa. Sometimes that we talk about as gliding too. Okay, again, know the difference between high vowels and low vowels, okay, because we want to consider that in terms of intervention. Initial consonant deletion is less typically seen than final consonant deletion, but it is an error pattern in which that initial consonant, that beginning consonant, is deleted. We also want to make sure we understand interdental sounds, okay? So those are consonants produced with the tongue tip protruding between the upper and lower front teeth. Those are our TH sounds, both the voiced and unvoiced. We have labial sounds, okay? Labial assimilation, actually, is another error pattern, another phonological process in which those consonants assimilate to a labial place of production. Whereas you might get a word like, bed, okay? And that final d sound, which should be more of an alveolar sound, is assimilated to the labial position of the initial b sound. So the word bed, B-E-D, would be produced more like beb, B-E-B. Lateral sounds are produced with air flowing over the sides of the tongue. Okay, those are, the only sound that we have is the ul sound where air flows over the sides of the sound. Okay, we often see lateral lisps or, a lateral S is where air flows over the sides of the tongue, okay, that we don't want. We don't want a sh sound. We want the air to flow nice in a central direction when we're producing a s sound, an S sound. Okay? So lisping, okay, can happen either laterally, okay, where the air flows over the sides of the tongue that we don't want, or frontally, okay, a frontal lisp, where the tongue protrudes out of the mouth and does not stay behind the teeth. Okay? I skipped around to lisping for a minute, but I want to make sure we understand what a liquid is. Okay? Where there's, liquids are those sounds where there's a large space between the tongue and the roof of the mouth when they're produced. Okay? So those are ul and unlike the glides. Okay? Which are y and w, where there's little constriction between the articulators. Okay, what else? Metathesis as opposed to epenthesis. Metathesis is an error pattern in which the order of sounds in a word is reversed. So you guys hear that often in words such as like elephant, effluent, or spaghetti might be buschetti, things like that. Telephone is tephone. No, that's really not metathesis, but you understand what I'm saying. Nasals are obviously sounds in which the air flows through the nose because the velum is lowered. We have our and our and our okay, but if a sound is not supposed to be produced with air flowing through the nasal passage, we often say that nasalization has happened. So usually oral stops, where the air should go through the mouth or stop in the mouth, may release into the nasal passage and produced as a nasal stop. Excuse me. Okay, a couple more on our vocabulary list. An obstruent. Obstruent are oral stops, affricates or fricatives. Open vowels versus closed vowels. Open vowels are produced where the tongue is relatively flat on the floor of the mouth, on the bottom of the mouth. So you really should go through your vowel quadrilateral to identify those open versus closed vowels. Palatal sounds. Palatal sounds are where the place of production is where the tongue is approximating the hard palate, and that's the j sound, where you have a large portion of the tongue approximating the hard palate. Okay. Let's make sure we understand what a phonological process is. A phonological process is a description of a systematic difference between a client's speech and the speech that is appropriate in that client's community. So phonological processes are sometimes called phonological patterns. Phonological processes are systematic, right? It happens on every production of that same speech sound or group of speech sounds. It's systematic, okay? It's a pattern. It's a pattern that most people go through, okay? Sometimes more quickly than others, and therefore we don't see it as an error. But if a phonological process or a pattern is held beyond a specific age when it should have been inhibited, then we see a phonological error. Okay? Let's see. Sibilant, okay, that's when we talk about some distinctive features. Sibilants are alveolars or post-alveolar fricatives, where the sound provides that hissing type of sound. Sonorants are sounds which are relatively unobstructive. So those are your open sounds, your vowels, your nasals, liquids, glides, those are sonorants. Okay? Spreading, we could talk a little bit about. It's when you stretch your lips, kind of like you're making a smile in order to produce a s or a z. Sometimes front vowels are produced with a spreading as well. Stimulability. Stimulability is something that we definitely want to know what it is, and we're going to get in depth about stimulability, but it's basically the child's ability to imitate a sound. Are they stimulable for a sound? Are they able to imitate that sound, and therefore is it going to be a focus of intervention? Stop sounds, there's complete closure at some point in the vocal tract. Okay, and you guys should be familiar with some examples of stop sounds. Stopping is actually a phonological pattern or error process where children will stop sounds that are not meant to be stopped. So fricatives or affricates that are supposed to continue will be produced as stops. Substitution is basically just the replacement of one sound for another. Okay, that's an articulation disorder. Let's see. Syllable deletion is another phonological pattern or process in which typically the unstressed syllable is deleted. So, for example, you may have banana produced as nana, pajamas may be produced as jamas, things such as that. Vowel neutralization, again, I'm talking a lot about vowels right now, but vowel neutralization is when a vowel is replaced with a neutral vowel. So that neutral vowel is and any other front or back or high or low vowels that are not supposed to be neutral or centrally produced are produced as an So, cat would be produced as cut. They've centralized or neutralized that vowel to an Okay. I think I'm going to leave it there in terms of a vocabulary list. I kind of went through a great deal. But I want you to stay tuned, okay? Because the next audio clip that I'm going to pop online is going to reflect our introduction, our talk about typical development, okay, in terms of articulation, normal aspects of speech articulation and speech sound acquisition. So that's what I'm going to be talking about on the next audio clip. All right, thank you.